actually done my first open house at my city hall. We actually turned it into a town hall. Had several hundred people. You got an issue that's on your mind?
I would like to ask you about AB 880. Are you familiar with that?
Working on it a lot. AB 880 is a bill by a colleague of mine, Assemblyman Jimmy Gomez, that has gone through the policy committee and will eventually reach the floor. It's looking at how to adapt, how to better adapt California and our sort of government institutions to the implementation of the Affordable Care Act. And I would say it didn't come to any of my policy committee, so I've actually been spending, I think at this point I'm probably about 3.5 hours reading the bill, reading the announcements, reading the correspondence, just trying to think through that bill. And I would sort of say I'm still in process on this bill, but it deals with implementation of the Affordable Care Act in California.
Are you aware that the proposes under the 10 years?
AB 880, as most recently amended, only applies to businesses that, we're going to get sort of policy geek here, that have 500 more employees. So a lot of, any business in California that has fewer than 500 employees is not touched by that bill. What the bill is proposing is if an employer chooses to, under the Affordable Care Act, employers are required, this is federal law, required to provide health benefits to their employees, full-time employees. That's sort of federal law. The issue that raises the question is, if you're an employer and you cut the hours of your employees so they're not full-time, what do they end up doing for health care? In California, if you have a person who, because of the wage they are paid or the hours they are given on their job, cannot get their health care through their employer's program, then that person can end up on Medicare, Medi-Cal, and the taxpayers end up paying for their health care. So this bill is asking the question, if you have really big employers, 500 more employees.
Walmart, what's up that big?
Walmart, business, but it's not mom and pop stores. This is not smaller businesses. This is big businesses, 500 more employees. If they are running their business in such a way so as to push a lot of their employees into part-time status or insufficient hours so they can't get health care, so that those people could end up on a publicly paid for health care system.
That's what Obamacare is. They have that option. Here's my point.
Yeah.
These are the companies that provide jobs. If you're making it so that, and Obamacare has already been shown to be an extremely expensive program because they did not address the issue of premium costs. They only addressed the issue of getting wider coverage of health care. So you're forcing the same companies that are giving people jobs in this state to underwrite a major snafu. And this bill exempts government. It exempts all level of government with 500 employees or more. It's exempt. So you guys aren't even taking responsibility.
It's not my bill.
Excuse me,
No, just bring it to your
ma'am,
attention.
when you make statements of fact, please tell us where you got the information.
No, it's all right. I'm the member. Comments should be directed to
So we
me.
need to know where the
It would be good to know, because as I understand it, those are the rules for the government. That this is basically following the federal plan, the way the federal government.
No,
has
she
it.
is correct.
But my
She's
concern-
discussing this particular bill.
Yeah.
And since this bill is designed for, the assumption is that most big employees with regular employee staff, healthcare is going to be a part of their benefits. We're talking big companies, big businesses. So the focus of this bill is more on if you have a big business, which has implemented a business model to cut the wages and hours of certain employees so they don't qualify for health care. In that scenario, if those people end up getting health benefits, they can end up on Medi-Cal where taxpayers are paying for this. In that sense, actually, that big business that organizes business that way is in competition with another business that actually provided health care to the employees, getting sort of a competitive advantage in the marketplace by the taxpayers providing health care for their workers. But since AB 880 is to try to stop, again, big employers that implement this plan, because it doesn't affect any sort of mom and pop business. Since the purpose is sort of the taxpayer issue, I think that's why governments were cut out. But again, I haven't seen the bill. It's still in appropriations. I see it coming. I've spent about 3.5 hours this week just myself trying to understand what's going on. Because we don't want to chill job creation. The U.S. Supreme Court has upheld the Affordable Care Act. That was the Roberts Court, was done last year. It's upheld. So it is sort of moving forward. So now you're left with a situation of if certain companies are moving forward and providing health care, it does become an issue if you have sort of some companies are trying to evade it. And I sort of described when I was a young guy, I got asked to run this big policy committee, this finance insurance committee in 1988, when I had never run a policy committee. And one of the unpleasant tasks I had to deal with in the late 1980s was the state savings and loan crisis. You remember the savings and loan crisis and Mr. Keating and all of those problems out there? And I remember at the time forming the impression that part of how we had got there was that some companies engaged in very, very bad business practices in the savings and loan sector. And other companies didn't, but other companies didn't speak up either. And so you sort of had, it's sort of the one bad apple spoiled the barrel type of thing. You had certain bad actors engaging in business practices which were not good. And it sort of led to a malignancy in that sector. Anyway, this bill is very specialized to deal with big employers competing with other big employers, assumes that most people are actually going to provide benefits to their employees, but it would be possible to game the system by cutting hours and benefits to certain employees, in which case the burden of health care will end up on taxpayers, and I don't think anyone wants to see that. But it's a complex issue. But I am working hard to understand it and think through the ramifications.